Hello everyone, Dr. Paul Kilgore here, and I have some very important information I think you can use today and going forward for the rest of your life. So, number one, as you may have heard, there is now a new outbreak of measles in the United States. So I want to take you back to 1989 when in the United States we had another very large measles outbreak. You know, at that time in the first half of 1989, the US CDC reported 7,335 cases of measles. There were 10 confirmed deaths, and there were another 30 that were suspected to be related to measles infection. So why do I talk about this? Because if we are seeing measles cases now, even if it's a very small number, one of the things that you must know is that measles is one of the most transmissible viruses that we have in the earth, around the globe. And one of the things that you need to know too is that with measles, it's very hard to tell who may be infected early on. The symptoms may not even appear for a couple of days at least, and so that incubation period is a time when people can transmit the virus. Now, people who are unvaccinated are the most likely to transmit the virus. Also, if you want to protect yourself, there's really two things to know. One is that the vaccines are out there and they're available from local health departments, from pediatricians' offices, family practitioners, and even some pharmacies do offer the measles vaccine. Why is the measles vaccine so important? Because it gives you protection. In fact, it gives your kids protection. So the first dose is between 12 and 15 months of age. The second dose around 4 to 6 years of age. And the good news with 2 doses is that you will be fully protected. Your child will be fully protected. The symptoms of measles, if they do get it, are appearing rather mild at first. So a fever, maybe some rash, maybe a cough, maybe coryza, runny nose, red eyes, that kind of thing. But there are rare cases when kids do develop a brain infection. And the brain infection can be severe. We call that encephalitis. And when we get severe infections in the brain, we don't know what will happen after that. It's very difficult to predict how severe it may be. So we want to protect kids against measles, but we also want to use that vaccine. The MMR2 is one of the most common vaccines out there to protect against not only measles, but also mumps and rubella. Mumps and rubella I'll talk about in future videos, but the key thing about these diseases is that they can cause severe disease as well. They can often mimic measles, so they have signs and symptoms that look similar. Fever, maybe some runny nose and cough. They are respiratory infections at first. But the other thing to know about measles is that it is a systemic infection. It can go throughout the body. And so as a result, we really can't predict who's going to get severe disease and who's not going to get severe disease. So, my message to you today is make sure you talk with your pediatrician, talk with your local health department, and make sure you go in, check your child's vaccination records today. Make sure that you begin them on the road to get that vaccine because it's extremely important. The most common side effects with the MMR vaccine, I just checked on CDC Wonder, the most common one is fever. We call that pyrexia. That can be treated later on if that does occur with things like Tylenol. Other things that can occur with the vaccine are at the site where the injection goes. We can have some redness, we can have some irritation, some pain or discomfort. There can be a little bit of swelling, but those are generally mild and the child will recover very quickly after that within a few days. Now, keep in mind, when you do get the vaccine, it's very important to make sure that you go in for that second dose. One dose is just not enough. We need to have that very high level of immunity, that high level of antibody to protect fully against measles. So make sure you go in for that second dose when the time is right. The other thing I want to mention with MMR and measles vaccines is that they are not only, they've been around for a very long time and tested, but the adverse events that we see are not those that you may have heard about in myths and misinformation, things like autism. That has been debunked many years ago. So make sure that you check the real data. Make sure you talk with your provider to get the real story on what the adverse events are. If you have any questions, shoot me a comment down below. Subscribe to these videos. We can talk and have that conversation. I'd love to speak with you more about this. But make sure you do protect your child because no one wants to see a child get severe measles and like we did back in 1989. And you can check that in the MMWR from December 22nd, 1989 to see how severe that epidemic was, and that was just in the United States. So, thanks very much, and we'll see you again soon.